Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Good. Jared, how are you?
I'm doing well. I'm excited for us to have the opportunity to speak and love your background, by the way. So clean, so nice. You got to love these virtual backgrounds.
I appreciate them.
Absolutely. Well, I think we should dive right into it. You and I we've talked in the past, but I'd really love if you could tell the audience a little bit about yourself, kind of your background and how you got to where you are today with Sofia Health, if that works.
Yeah, absolutely. I'll just jump right in. So I started in healthcare when I was 18 years old. I was a aeromedical evacuation technician for the National Guard, working with patients in combat, humanitarian, and hospital settings. Aerovac crews, if you're not familiar, are responsible for trauma patients, like leaving the theater, the combat zone, taking patients to the next echelon of care. I guess a close equivalent in the civilian world is like an advanced EMT, different scope of practice in the military. But we deliver as a team patient care in flight. So I spent 7 years working with trauma patients in this acute care setting. My career has also spanned operational roles in Air Force Reserves. Being in the Bay Area, I also jumped into tech. So the first startup, I ran sales and marketing for a physician-led team developing technology to enable patients to access their medical records. A few things transpired, and personally and professionally, to include an injury that led to the formation of Sofia Health. This period with an injury, I spent a lot of time searching for alternative therapies and interventions so I can heal myself. And this search process was just extraordinarily difficult. But from this, I was able to take a look at the healthcare system through the lens of chronic pain condition. And it was suddenly very clear that this system was not built to handle your needs holistically. And I knew something had to be done about it. So I felt it was a necessity to give consumers agency over their health, but also from the practitioner's point of view, I saw this as an opportunity to empower more health and wellness entrepreneurs. So all of this led to business school, where I met my now co-founder, Jenny Zamberlin, and we have since developed the Sofia Health platform.
I love it. Yeah, it's I've taken a look at the website, and I hope I get to compliment people on this. I don't always get to, but I love the name. I love the branding, great colors, great website. So kudos to you on that front. It's sad, but I don't always get to say that to people, unfortunately. Can you tell us more about, I mean, you went into it a little bit, but can you talk us through basically your why, how, and what as quickly, I guess, as you can?
Yeah, absolutely. So what does Sofia Health do, right? So we make it easy for consumers to find and connect to these independent health and wellness professionals. So we put individuals at the center of their care, allowing them to choose the type of care and the type of practitioner or provider that works best for them. Now, we're a two-sided marketplace. So we provide practitioners with a turnkey business infrastructure so they can get online, get their services uploaded and get connected. But our platform actually integrates the tools they need to get online. They get the customizable webpage, billing, scheduling. For practitioners and these healthcare professionals, we're trying to alleviate their need to spend all their time on the business operations and client acquisition side. And then from the consumer side, we're an on-demand booking platform. So our infrastructure actually simplifies that search and booking process for consumers. So now individuals can search for holistic health and wellness, alternative interventions, or even products, actually. So that's what we're doing.
So who pays in this situation in your two-sided marketplace? Is it both the patient and the different type of provider?
It's just the practitioner pays us a flat monthly fee, and this is free for consumers to access. So now they have access to care, and all of the practitioners on our platform are independent professionals, so they can charge what they need. It's up to them to choose their pricing model. Some have pro bono, so we're just a matchmaker platform.
So with these different matches, what would you say is an area of your platform that like you really have the most of a certain type of healthcare professional where someone can go on and be able to find that type of care?
Yeah, so we have a lot of health coaches, fitness coaches, wellness coaches, naturopathic physicians. But what that's done is they're not limited to a certain type of care. Like this really spans, like whatever their background is, it spans all sorts of different wellness. So a consumer can come in and find mental wellness and get help with sleep, fatigue, depression, anxiety. Conversely, they can come on and find our holistic nutritionist also touch anxiety. So this was the premise. This is the reason we did this the way we did, is because one title does not limit you to one type of care. Our health is not siloed out. Like we are holistic human beings. So one health coach could touch your mental health, your emotional health, spiritual health, and your physical health.
I love it. I love it. What are some of the things you're really excited about as we head into the second half of 2021?
Yeah, just continuing to grow, to be honest. We have such a wide spectrum of practitioners that are on the platform today. And I think that's really important to offer consumers the access to integrative, functional, holistic, Ayurvedic, herbal medicine modalities, interventions. And I think what we're excited about is just continuing to bring in these different types of practitioners to help them with their business practice. But first and foremost, we want to ensure that the consumer knows all the different types of care, interventions, and modalities that are available.
Perfect. Well, I'm really excited to continue to see the growth. Where can people learn more about Sofia Health?
Yeah, you can go to sofiahealth.com and you can visit, you can search for practitioners, you can find symptoms, get your health goals, needs met there. If you need me, go to LinkedIn, message me on there, or visit our support. So
perfect. And I'm going to throw all of this in all those links in the show notes, so listeners will be able to easily go and get in touch with you or anyone at Sofia Health. And just so the audience knows, the goal is to have you come on the podcast in the future. We can build out some additional content together. We can focus in on different areas specifically within Sofia Health. This is really your intro podcast where they get to know you and Sofia Health. For hopefully a lot of people that already do know about you, but for the ones that don't, they get that intro and continue putting together some great content together. So I'm excited.
Yeah, we are too. We're looking forward to seeing what comes next. And so we appreciate it.
Absolutely. Thank you.
Thanks, Jared.